Today, I want to talk to you about type 2 diabetes. Type 2 diabetes is a growing epidemic in the United States. I am an only child, and my father, Henry Yarbrough, has type 2 diabetes. He was diagnosed in 1984 and has had the disease for 32 years. And I have personally seen what the disease has done, not only to him and his body, but also to our family. Type 2 diabetes is the seventh leading cause of death in America. 29 million people have type 2 diabetes, and 386 million people that are age 20 and older have pre-diabetes. Now, according to the American Diabetes Association, the cost of diabetes in the healthcare industry is $245 billion per year in direct and indirect costs. Today, I want to explain what type 2 diabetes is according to the medical industry, as well as causes, preventative care, and treatments for type 2 diabetes. According to the American Diabetes Association, type 2 diabetes is your body's inability to properly use insulin. They call this insulin resistance. Your pancreas will make extra insulin to try to offset your blood glucose levels. And over time, it will not be able to keep up or make enough insulin to keep your blood glucose levels at a normal rate. Now that we know the meaning of type 2 diabetes, let's look at some of the causes. Being overweight. Being overweight gives you a risk of having type 2 diabetes, and it can cause type 2 diabetes. The more fatty tissues you have, the more resistant the cells are to insulin. Second, the lack of physical activity. If you're not physically fit or physically active, walking maybe 3 times a week, that can cause type 2 diabetes if you're inactive. As well as family history. My father, who I did a personal interview with, said that his brother and sister both suffered with the disease, and the disease was really the cause of their deaths. So if you have a sibling or a parent that has type 2 diabetes, you're more susceptible to have it. Now, there are treatments for type 2 diabetes, and they're not a cure yet, but the doctor can put you on a treatment regimen. As I said about my father, he is on insulin as well as pills that regulate his type 2 diabetes. He has lost a significant amount of weight, and that has helped to actually take him off some of the medication, because losing weight helps you to maintain a normal blood glucose level. And he also has to monitor his diabetes and then monitor his glucose level, and he uses a blood glucose machine like this one that I have, a monitoring machine, and he has to use it 3 times a day to check his numbers to see if his levels are up or down. Now, we've talked about what type 2 diabetes is, we've talked about some of the causes, and we've talked about some treatments. Lastly, I would like to talk to you about preventative care. To prevent type 2 diabetes, weight loss is one of the ways to prevent it. The more weight you lose before you get the disease, the less susceptible you are to it. The Mayo Clinic says that losing 7 to 10% of your current body weight will cut you getting type 2 diabetes in half. Also, changing your diet. If you eat even two servings, extra servings of whole grain foods, it cuts your risk of getting type 2 diabetes by 21%. And increasing your physical activity by just exercising 30 minutes 5 times a week. Walking, running, swimming can also reduce the risk of you getting type 2 diabetes. Type 2 diabetes is a growing epidemic in this country. It is not only affecting the people that currently have it, but it's also affecting the next generation, as well as medical cost. Like I said with my father, I have personally seen what type 2 diabetes has done. And I just want to make sure that you have the correct information about what type 2 diabetes is, the causes of the disease, and even treatments if you already have the disease, but more importantly, preventative measures if you don't have the disease. The more we prevent the disease from happening, the more that we can make America healthy and stop this epidemic.